Good morning, everybody. Welcome to the Extended President's Council webinar of Thursday, August 20th, 2020. I am Bruce Celeste, Chief of Staff to President Rodriguez. Today, we are very pleased to welcome Deputy County Executive Dan Lynch and Albany County Department of Health Commissioner Dr. Elizabeth Whalen as our special guests. For Mr. Lynch's and Commissioner Whalen's benefit, I would note that our President's Council is comprised of the President and his Executive Council, our Vice Presidents and Deans, and their senior staff, as well as our student leaders. The President's Council numbers about 75 persons. Since the COVID pandemic broke, we have opened these meetings up to all faculty and staff and student leaders, and these extended President's Council meetings have become a great way of sharing information across campus during the COVID pandemic. We encourage all faculty and staff and student leaders to attend them as best they can. As is our ongoing practice for these meetings, the President's Executive Council is in the background should any questions come up during our question and answer period that are best directed to them. This session is being recorded and will be posted on our UAlbany COVID website. Thank you again to all of our university community tuning in, and I would remind you all that your questions are indeed encouraged. You need not wait for the Q&A period to type them into the Zoom. We will address them as best we can in the latter portion of our time together. So do feel free to type in your questions as you think of them along the way. I now turn the podium over to President Rodriguez. Mr. President.
Thank you so very much, Bruce, and thank you all for joining us today. To our audience, thank you so much for being with us this afternoon, or this morning, I should say. It's always a great pleasure to be with all of you. Let me start by indicating, as Bruce indicated, that I am so pleased that with us today are Albany County Deputy Executive Dan Lynch and Dr. Elizabeth Whalen, Commissioner of the Albany County Department of Health. I want to thank them for their ongoing work and their partnerships with our communities throughout the county, including with UAlbany. They have had a great deal of very tough challenges, but they have done an excellent job. Also, I want to thank all of you for joining us today, and especially for everything that you have done to make it possible for us to reach this day. Here we are. Many students are already arriving on campus, and classes begin on Monday. It has been a monumental task to get to this day, but because of your very hard work, we are prepared to begin what will be another unprecedented semester. It seems like a lifetime ago, but this process really began in late January with the creation of the COVID-19 task force. This group did an excellent job in setting up the structure for communicating and coordinating the innumerable actions we had to take. Then we launched the UAlbany Forward Together initiative, led by our provost, Dr. Carol Kim, which took on the monumental task of planning for this fall semester. I also want to give a special shout out to our leading teaching faculty who have put in an untold number of hours creating our multimodal system of teaching and learning. This was no small feat with a large supporting cast, but I would be remiss if I did not express our appreciation to the amazing folks at ITLAW, the Educational Technology Services, and the Office of Online Teaching and Learning. Thank you for providing the trainings, resources, and tools for faculty to support teaching in new modalities. And there are so many others who have contributed to our success to date. I also want to recognize the team of 34 volunteers who have been delivering meals every day to 68 quarantined out-of-state students. Thank you so much for being part of this critical effort. Meanwhile, many other important initiatives are in motion. In the category of excellent news, the New York State Writers Institute is leading a major symposium this fall that will address systemic racism in conversations with major authors and community partners. We are very excited about this event, along with our broader agenda for programs related to diversity, equity, and inclusion. So please stay tuned for more details. On a related note, we are very pleased to announce a $1 million grant from the Hearst Foundation to expand graduate fellowships at the Center for the Elimination of Minority Health Disparities. This area has emerged as a core strength for UAlbany, especially as we are leading the state's research on the disproportionate impacts of COVID-19 on minority communities. Further, UAlbany's choral ensemble has created a 477-member virtual chorus with choirs from the United States, Australia, and New Zealand. They will have their video premiere next Tuesday at 7 p.m. when they will perform a piece of the oratorio considering Matthew Shepard entitled All of Us. I am honored that they have asked me to bring greetings to the chorus members, and I am very excited to hear what promises to be an extraordinary performance. Finally, and critically important for all of us, our graduate enrollments are strong, and our first-year retention rate is now at over 82%, the highest it has been in several years. This is all possible through the amazing work of many of you, including the Graduate School, the Office of Undergraduate Education, and our schools and our colleges. These are just a few examples of the good news that continue to come from across our 3 campuses. That said, as is the case in all SUNY institutions and in colleges and universities throughout the country, we are facing some very serious financial challenges at UAlbany, unparalleled to anything I've seen before and probably anything you've seen before. We've extensively discussed these challenges with the university community. However, after classes commence and we have more or less final enrollment numbers, residence hall occupancy rates, etc., my goal is to send out a communication so that everyone knows where we stand financially and how a number of very diverse factors contribute to our current and delicate financial situation. We will do our very best to also keep you informed on this front. Nevertheless, it is absolutely critical that we continue to move forward as a vibrant and resilient community, even as we recognize the challenges we face. I also want to highlight what we're doing and will continue to do in the midst of COVID-19. We have developed a layered approach to health and safety, which includes pre-arrival testing of students, quarantining students from states on the New York State's travel advisory list, reduced density in our classrooms, residence halls, and other public spaces, mandatory face coverings, physical distancing, hand hygiene, daily health monitoring, surveillance testing, and contact tracing. All this combined with excellent and robust information sharing to reinforce the need for all of us to help prevent or reduce the spread of COVID-19. The Office of Communication and Marketing has done an excellent job in this regard, and you will see their excellent work throughout our campuses and on social media. We also have the fortune to be in a state with a low COVID infectivity rate, thanks to the vigilance from the state and local health officials who have put strong rules and practices in place. I would also like to highlight that while we have worked extremely hard focusing on the safety and health of our campus community, this is a collective as well as an individual responsibility. We all play a key role, and we are all responsible for reducing the spread of COVID-19. Part of the way we have navigated these unprecedented times is by coordinating and collaborating with key partners. And today, we have 2 of those partners with us. Since the arrival of COVID-19, or COVID, we have been in very close contact with the Albany County Department of Health and with the Office of the County Executive. They have been true partners during this difficult chapter, and that will certainly continue this fall and beyond as we closely monitor COVID-19. Clearly, there's much to discuss. That is why I am so pleased that with us today are Albany County Deputy Executive Dan Lynch and Dr. Elizabeth Whalen, Commissioner of the Albany County Department of Health. We invited them to join us to give us an update on the county's work on COVID-19 in terms of prevention, education, and contact tracing, and how we are all doing on this front as a community. Deputy County Executive Lynch, Dan, and Commissioner Whalen, welcome to UAlbany. Commissioner, welcome back to UAlbany. You've always been part of UAlbany, and you are a proud alumna of this great institution. So thank you for joining us today. Dan, the floor is yours.
On campus, and it's truly amazing every time that I do get back on campus to see the evolution of the school, and I'm so happy to be a part of this program this morning. I want to take an opportunity to recognize the President's Council, including the Executive Council and the UAlbany's Vice Presidents and Deans and all the staff and student leaders that are participating here this morning. And particularly a big thank you to you, President Rodriguez, for being a partner with Albany County, with the county executive over the last several years, not just on COVID-related matters, but in general. And you've been a tremendous partner, and we're appreciative of that relationship. So thank you very much. Unfortunately, the county executive was unable to attend this morning, so you're stuck with me. And I'll do my best in kind of describing to everyone on the call and participating some of the trials and tribulations that we had at the county, the hurdles that we needed to overcome. And believe it or not, we've been dealing this for now over 5 months. And COVID-19 has tested and pushed us all to the limits, and the county's no different. And I want to discuss a couple of the hurdles that we faced along the way. So from a governance standpoint, we were met with a number of challenges to transform our workforce and staff into a remote world, which was pretty much non-existent in local government. So we went, and again, bear with me, through a number of hurdles that we needed to clear to make sure that we were continuing to provide the necessary services to our residents here in the county. So everything from adjusting our continuity of operation planning to securing new technology to provide opportunities for our workforce to work remotely. How to supervise a remote worker were issues that we were challenged with. Again, this is all, I want everyone to understand that the county delivers services that are essential to residents here in the county. And that could not stop. There was no pausing the delivery of services. And we received tremendous guidance from New York State, and I want to commend the governor and his team for the wonderful communication with our local government in providing us some guidelines and assistance to maintain that deliverance of services to our residents. One of the biggest issues that we faced during the early stages of COVID was securing PPE. And it's hard to forget about the time in mid-March, early April, but getting surgical masks and gloves and gowns for our workers on the front line was an exceptional challenge. And obviously, as we move forward through the crises, that became more accessible. But that was a big hurdle in which we needed to overcome. We were responsible, and I'm sure Dr. Whalen will talk about the challenges of quarantined individuals and the steps that went into that. But we needed to, on the front end, find suitable housing for those that were being quarantined to make sure that they were in a safe and secure place away from other family members or friends, and the delivery of food to them. We needed to continue the high level of service that we provide at our nursing home, Shaker Place Rehabilitation Center. And those are our most vulnerable residents. And making sure that our staff was adequately equipped with the proper PPE. I commend the county executive for having the foresight of closing down our nursing home earlier than what was required in the state to have that ability to see down the line of what effect this virus was having on our most vulnerable residents. We also, in the county, instituted testing for our staff members well before it being part of a executive order signed by the governor to ensure that we were doing everything to protect our residents there. One of the biggest challenges and where UAlbany really assisted us tremendously, the university and New York State, was with testing. We are very fortunate in the county to have a number of opportunities for residents to receive testing. That was not always the case. In late March and early April, our community testing closed up. There was a collaboration between St. Peter's and Albany Medical Center, and there was a period of time in which their community testing was unavailable. And I, again, commend New York State and the leadership with the university in providing community-wide testing here on campus, which is still up and running and very vibrant, and provides the county with a real snapshot daily of the infection rate here within our county. But we at the county had our struggles. We worked tirelessly around the clock to work with partnerships, in partnerships, to provide testing to not just those individuals that had access to a vehicle that could come to the UAlbany site, but that were unable to make it by vehicle. And we had a great, wonderful partnership with Whitney Young, which is still set up and running daily, where we had a mobile testing site, the first of its kind in New York State, right here in our backyard, in the county, where we went to residents that were unable to travel to a site. That is something that I know the county executive and I and Dr. Whalen are tremendously proud about. These are underserved communities that have some hesitation about getting tested, and we brought the testing to them. And everyone knows that there is some racial disparity in the number of individuals infected and the circumstances surrounding those communities. And we stand tall and proud about being able to partner with them in making sure that we're getting a full picture of the community, not just a portion of it. We partnered with Rite Aid and Urgent Care. We worked around the clock in our struggles in obtaining PPE also were struggles trying to get tests and test kits and laboratories to process those test kits. This is not as easy as it seems to be right now. These were real struggles early on. And through the county executive and our staff, we were able to reach out to the communities and medical communities and make sure that we had the proper amount of PPE, the proper amount of testing, and a laboratory to process it. We're very proud about that. And I know Dr. Whalen will talk about the extensive efforts of her department, and I want to commend her leadership, and her wonderful team that has really worked tirelessly throughout this entire process. And she'll talk more about contact tracing and quarantine. But we again, and you'll hear me say this, and you hear the county executive say this, we can't achieve any of these goals without partnerships. We reach out to the New York State National Guard. They were a tremendous partner in helping us through quarantining and food delivery, and were with us for 2 months and delivering hundreds and hundreds of packed meals daily, and we're forever grateful to them. We also cross-trained a lot of our department staff to assist Dr. Whalen and the health department from quarantine checks and other responsibilities that she set them out to do. Some of the things that we've developed through the process, again, with the leadership of Commissioner Whalen, we put together a COVID dashboard tracker, which is on our website and is updated daily. It provides a breakdown of the health data in the county, everything from gender, race, and zip code of those affected, age, and it does unfortunately highlight the racial disparity that exists not only here, but in other parts of the state and country as well. And again, I applaud the executive's efforts in bringing testing to those minority communities. We realize in looking at the dashboard, and there may be some questions in regards to this today, about, and it's very fitting, our highest rate of infection right now by age group is the 20 to 29-year-olds. And that has been something that we have seen in the county for several months and now is growing weekly. The separation between the 20 and 29-year-olds and the next highest infection rate continues, that gap continues to increase, unfortunately. Fortunately, we're seeing that those younger individuals that are infected are not showing the same severity of the virus. They're not being hospitalized at the rate that our older residents are. They're not being received into ICU, and they seem to be able to battle the virus quickly. But if they're infected, they can get the next person infected. And that's, the campaign that has been ongoing from the state and the county level, and we need to continue to educate our younger, for here students and just our younger adults within the community. A couple more points and I'll wrap up. The county executive and the Commissioner Whalen have done daily briefings for the community, at one point reaching over 100 straight days. And I know over the last month or month and a half, we've kind of gone back to a couple days a week just to keep the community informed. And I provide that because it's a great public service that's being provided to our residents. A snapshot of the daily issues that are going on with our community. There's been a number of wonderful guests that have appeared on the daily briefings to educate our community and highlight some of the issues and concerns that they have as small business individuals or presidents of a university. And President Rodriguez and President Gibson from Siena College joined the county executive in one of his daily briefings and provided a great snapshot of what protocols and processes are in place for a safe and healthy reopening for your school. So a credit to just the public outreach from Commissioner Whalen and the county executive. And that campaign continues. This is a campaign that is one built on open communication and transparency and education, because we can all learn something. This is an evolution. COVID, we've learned so much throughout the last 5 months, and I'm sure we're going to learn so much more over the next several months. The county executive worked tremendously hard with the surrounding 7 county leaders in proposing a safe reopening plan. It seems like an eternity ago that we entered phase 1, but we've been in it. We've done a terrific job again in plotting our way through the different phases, keeping the community as a whole safe, and that was done in a collaborative effort with the other 7 counties and their leadership, and certainly the leadership from the state. One of the things that I know gets discussed, but is such a big issue that the county is staring directly at daily, is the economic impact that this has had on county government, county revenue. Just as a highlight, the second quarter sales tax revenue, which is essentially where our budget is built on, is the sales tax revenue, was down 15 to 16 million in one quarter. That is a devastating hit. The state is in dire circumstances right now with their budget. There's a high potential that there are cuts to be made from state aid to local governments, which would obviously include Albany County. So preparing our budget has been a tremendous challenge. There are many unknowns. We are encouraging folks to get back out and do so in a safe way and utilize small businesses. I know the county executive has really been pushing and beating the drum of protecting our neighbors and small businesses. They need your assistance. They are the backbone of our community. They are also the ones that sponsor Little League teams and soccer teams, and they're really at they're struggling and they need our help. And I would ask folks to shop local. I know that the county executive will be announcing a campaign in the very near future to promote the local shops, keep their doors and lights open. We need them in our communities, and I would ask everyone to do their part. And, just my final comments here, there was no playbook to how to deal with COVID-19. And New York State, Albany County has created a number of wonderful partnerships through this crisis. We've created new strategies to help flatten the curve. We've kept our residents educated through daily briefings, and we continue to promote safety, proper guidelines to keep us safe. I'm really excited to be here. I'm excited for the university to be opening its doors to new students and existing students. I wish you nothing but the best and success, and certainly your partnership is valued, and anytime that you or any of your staff need anything, President, please feel free to reach out. Thank you.
Thank you so very much, Dan. Again, it's a pleasure to have you here with us today. And as you know, we've been working very closely with the county, and we've been monitoring all the great work that you folks have done. My dear friend, Dan, the other Dan McCoy, the commissioner, you and everybody else, in terms of ongoing communications with the community, right? The communication has been relentless. It's been ongoing all the time. You folks have been really proactive. And so we appreciate everything that you have done. We sincerely appreciate this great partnership that we have with the university. And we know you have great partnerships with folks throughout the county. So once again, thank you so very much. And I look forward to more interactions as we go to the question and answer period. But now I'd like to again welcome Commissioner Whalen. Thank you for being with us today. We really appreciate it, as there's no doubt that you and your staff are probably one of the busiest, if not the busiest group in the entire county, right? Your work has been, since we started back in March, interacting with you and interacting with all the folks in your department, right? There have been major challenges, but I think once again, Albany County Health has proven that you've got great people, great leadership, and you've done an outstanding job to continue to monitor and move us in the right direction. So thank you again so much for being here, and I'll pass it on to you. Thank you, Commissioner.
Thank you so much, President Rodriguez. It's my pleasure to be here this morning, and I appreciate the remarks of Deputy County Executive Dan Lynch. It's been a long 6 months. We've been planning for pandemic for as long as I've been involved with the county workforce, which is since the early 2000s. There's been so much work that's gone into this. Our staff has been written preparedness plans. There's still a need to create kind of a dynamic conversation going forward to be able to respond in real time. I want to remark on your opening remarks and really say that, in the conversations that I've had with educators in Albany, whether they are from the pre-K sector all the way up to university, I'm really impressed with the fact that everyone is embracing this very steep learning curve of what we need to do to effectively respond. And in particular, SUNY Albany has been with us since the beginning of this pandemic in preparing for response. The preparation and the ongoing nature of this needs a lot of open communication. And I think that is a cornerstone to our relationship with SUNY. We have to plan, we have to educate continuously. As Dan just spoke about, we know that the college-age population are a particularly tricky population in terms of education because of the nature of who we all are at that age, which usually is very social beings, right? We want to be with our peers, we want to be out and about, we want to be at gatherings, and this is completely against what we need to advise people to do right now. So it is a challenge, and on the other hand of that, most of your population are blessed with beautiful health and feel like this can't necessarily affect them in a negative way. So there really is a lot of education that needs to continue to go on with the university age population. And then, there's the response, so we have worked with SUNY in many times in the past with other reportable communicable diseases. And again, the role of the health department, we get all the reports of reportable communicable disease, and this will of course include COVID. And we work very closely with you to ensure that we can do case investigation, which is looking at the cases, determining where they may have been exposed, where they may have been while they were infectious, and who their contacts are. And then how do we contain the infection? So how do we ensure that the individual who's infected is isolated? And how do we ensure the individuals who are exposed are in quarantine? And those right now are legal orders. And we work very closely with student health services to ensure that those recommendations are implemented. And so far, I think, the communication that we've had back and forth in the preparation phase, and we did need to respond in the spring. These are situations where the lines of communication are in place, which make the response so much easier. And I want to congratulate you and congratulate your wonderful staff at Student Health Services for the great collaborative response that we have with them. We have a staff here. Our Division of Nursing has an epidemiology staff within it who is responding to every single case. So every case that comes in, we reach out and do a case investigation, and then from there begin to launch the contact tracing portion of the investigation. How we control COVID in every environment is through the cornerstones of prevention, which is the important education around wearing masks, social distancing, frequent hand washing, and avoidance of large gatherings. And then there's testing. And as Dan Lynch indicated, we're very lucky in Albany that we have widespread availability of testing for COVID-19. And I understand you have a plan to be able to do some testing internally with your student health services, and you also have on your campus the testing site. Having this ability to test is very helpful because we can then utilize the steps that we have to be able to control and prevent outbreaks. We may get single cases. What we want to really do is to prevent outbreaks. I think that the relationship that we've had in the past and what we are doing going forward is something that I hold a lot of confidence in towards how it's going to work to get back into session for the students. So I look forward to that continued collaboration. I know there's probably a lot of questions, so I'm going to limit my opening remarks, but thank you so much for having me this morning.
Again, thank you so very much, Commissioner. And just if I may put on my very proud president's hat right now, right? So as we look at the Commissioner and we look at Dan Lynch, how could we as a university, as a president, as faculty and staff, not be so very proud of our graduates that go on to become engaged global citizens doing amazing things, right? For the city, for the county, for the state, throughout the country. I mean, you two are just exemplars of the great students that graduate from this university. So, once again, thank you for taking the leadership role in these very, very difficult times. And thank you for everything that you have done. And I think the commissioner also mentioned a critically important point. I do a lot of work on the social and economic impacts of disasters. And typically when a major disaster happens, people say, well, the problem was that the communication process broke down. Well, the issue with that is that communication process broke down because it was never good to begin with. But when you have a strong foundation, like the relationship we have with Albany County Health and with Albany County and the commissioner and deputy and the executive and deputy executive, we've got a strong foundation to build on, right? And so I think this is what allows us to deal systematically with the challenges and the opportunities that we confront. So again, Dan and Commissioner, I am so delighted that both of you are here, and I am absolutely extremely happy that you both are UAlbany graduates. We're proud to call you part of the UAlbany family of the Great Danes. Now, Bruce, I know that you have a few questions from the UAlbany community, and so I'm going to pass it on to you so that we can begin the Q&A. Thank you.
Great. Thank you, Mr. President. Thank you, Mr. Lynch, Commissioner Whalen. We have quite a number of questions, and I'm going to jump to the top, and they kind of weave together. And the number one thing on everybody's mind seems to be, and this is for, I think, all three of you, can you comment on the differences between Albany County and what's happening in North Carolina, at Notre Dame, in Iowa and Georgia, Oklahoma, and other states where folks are having to close or go remote, both either in K-12 or in colleges and universities? And what separates us? And I think you kind of got at it a little bit, Mr. President, but maybe Mr. Lynch and the Commissioner could put a finer point on it.
Commissioner Whalen, do you want to take a stab, or you want me to start?
I'm happy to say a few things. In terms of what we're seeing around the rest of the country, unfortunately, is they are on their upswing. So we are starting to see more cases in places like North Carolina, in places like Georgia, and we are seeing a much higher positivity rate for those that are tested, along the order of between 10 and 30%. In New York State, we've been very proactive with this. We seem to have peaked earlier than many other parts of the United States, and our peak was pretty much focused on New York City. But at the time, what happened was there was a very proactive educational message that was reinforced by leadership throughout the state. And I think that consistent messaging and that leadership has enabled us to do a couple of things. And first, and perhaps most importantly, is to keep our infection rate low. We are currently across the state below 1% positivity. And that number means something because we know we're testing a lot of people. So having a less than 1% positivity rate is definitely to our advantage. The second piece is that we have had this consistent messaging. And I think it's not just through the governor's office, but it is through the county executives, our county executive, through the local health departments, through educational institutions like UAlbany. Everybody is advancing the same message on the importance of mask wearing, on the importance of social distancing, on the importance of hand washing. So I think all of those things together have put us in a much better place than many other geographic areas that are looking to start back into their college campus experience.
Just to echo some of Commissioner Whalen's points, there has been vigilance in our community in following the guidelines, the effective guide rails that have been in place to assist with flattening the curve. We've done a great job as not just a county, but as a state, and we should be proud of that. We're seeing states being ravished right now with high infection rates. It's very unfortunate. We lived it. We know the pain that they're going through daily, the struggles that are real, that exist for working families that have kids that are now working and being educated remotely. Those challenges are real. I have proof of it, having 2 young kids myself, of the challenges of holding a demanding job, excuse me, and trying to make sure that the safe and well-being of your children are there, and that they're being educated and they're being moving through the system effectively. Those are real challenges. We have been very vigilant as a community. There has been only a few sidesteps here from a few gatherings that, as we've seen in the city of Albany, one gathering can catch like wildfire. and one party can, turn in dozens of those that become affected. So it doesn't take much. We unfortunately read across the country the horrific stories of, large gatherings, just a absolute disregard to government's guidelines and CDC's guidelines and the effect that it's having. And I think with the leadership here at the university and the planning that is in place, there can be a safe and healthy return of your students in a successful fall semester. And as I indicated in my earlier comments, we don't know what's around the next corner. And it's having the flexibility to be able to pivot. And the relationships that you have with the Department of Health to walk you through those times where you need to pivot is an essential one. And I know Dr. Whalen and her staff will do her best in assisting the university and making sure that your students and staff remain safe.
No, you're absolutely right. So thank you, Commissioner, and thank you, Dan. We still need to emphasize, right, that the pandemic is still with us, right? That anytime there can be a turnaround. So we have to proceed with caution. We have to be vigilant. We cannot let our guard down, and we must implement all these public health policies that we continue to learn about, right? So again, I want to emphasize that this continues to be, it is an institutional responsibility, it is a collective responsibility, but it's also an individual responsibility. We all have the responsibility to ensure that our guidelines, our practices are put in place and that we continue to move forward as a community. I think that's one of the great things that we have going for us. But that said, we're not going to let our guard down. We're going to continue to be vigilant.
Thank you all very much. So following up on that line of questioning, the number 2 item that we get, and this is across days and weeks, we are constantly asked, what is the threshold of positive cases or other monitoring metrics for Albany to pivot to fully online or to send students who are currently in our residence halls back home? Mr. President?
So, let me start because, I fully understand, right, being a demographer and someone who likes numbers, I know that people want to hear a specific number, right? When you reach this percent or when X number of students are infected or faculty or staff by COVID-19, then we're going to go fully remote. I really don't think it's a good idea to put that number out there because I don't know what the magic number is, right? But I can say one thing, right? There are multiple items. As I said, we're taking a layered approach to dealing with COVID-19. We're going to have a series of practices in place, which you all know about. We're going to be working directly with Albany County, with the Commissioner and the Department of Health. We're going to be working with SUNY. We're going to be working with the state. And I think we will know when the time is after all these conversations. If there's a major issue, if there's a major breakout of COVID-19 at Albany, we will make a determination, and if needed, we will shut down the university and go fully remote, right? I mean, if we feel that the health and safety and well-being of our campus community is being seriously jeopardized because of the numbers or the infectivity rate here on campus, we will make that determination without hesitation. But we will not do this in a vacuum, right? We have to do this with the strong collaborations and partnerships we've developed with the state, with county health, with New York State Department of Health, and with SUNY. So that is the approach that we will be taking to this.
Dr. Whalen, are there any particular metrics in particular that the county would be looking towards or encouraging campuses, not just Albany in the capital region, but all campuses and perhaps even K-12 schools to look at?
So I think, in terms of looking at the metrics, there is one overall classification we can look at, which is the percent positive. And we know that if there is, a percent positive that gets up around, I believe that the 9% mark, we are going to be closing down schools in the area. But this is not our only indicator. And I think that the important thing is to have this dynamic communication. When we investigate cases, whether they be at local grade schools, whether they be at universities, what we look at very importantly is, how can we identify contacts? And if we can identify contacts and we can offer testing to contacts, and we can exclude people in that fashion, we can control outbreaks from occurring. A situation that we may decide to kind of talk about closure is if we start to see multiple cases that don't seem to be related, that are across different demographics, perhaps different parts of campus, perhaps unrelated individuals, and we really run into a situation where the caseload starts to increase to a way that we can't control and test our way out of it, then this is a discussion that we're going to have. But this is not, there's not it's not black and white. So there's not a number that I can say if there are this many cases. Because, for example, if you look at the cohort of a single dorm, and if you get a case within a dorm, the first thing that we would do is identify the contacts of that particular case, have them excluded, follow them along for 14 days. If one of them becomes symptomatic, then we identify their contacts, etc. So there's a pretty good system in place to enable us to control things from the get-go, and that is our aim, is to control individual cases so that they don't become outbreaks. But as we don't know how this is going to go in the fall, and we want to make sure that if we start to see these cases in multiple different areas, that we can respond appropriately to that too. And one thing that I should bring up, and I think that is very important in the planning, is that we are entering into flu season. So flu season is important because flu symptoms can be similar to COVID-19, and we really need to make sure that we can differentiate them. So it'll be important in the planning process to ensure not only that students can be tested for COVID-19, but that they can be tested for flu, because we want to make sure that we are able to readily tell the difference and implement the appropriate control measures.
Another thing I would like to add, Bruce, just related to what the commissioner has indicated, at UAlbany, just for our community here at UAlbany, we are in the process of also developing a dashboard very similar to what we're seeing in the county and across the state. So we're going to be monitoring the infectivity rate here on campus based on the results that we get that are available to us, where we have rooms for both quarantining students and for isolating students. So we're going to see how we continue to add capacity to that, and seeing how the number of students that need to be isolated and quarantine grows. So we're going to be doing a lot of monitoring. We have, people from the RNA Institute and from the School of Public Health and a variety of other people throughout the university that are going to be helping us in this process. But then again, at the end of the day, the decision that we make, if we make that decision, which we hope we don't have to go fully remote, will be done in partnership and in conversations with the commissioner, with the executive, with DOH, SUNY, and the state, as we have done throughout these past 5 months or so.
Great, thank you all very much. So one of the beautiful things about being at a research university is our faculty are very detailed and in the weeds, and they look at these issues from a variety of standpoints. And so Commissioner Whalen, a question came in the live Q&A, which several people pulled up, and they're asking, what are the implications of research confirming that infectious coronavirus in aerosols can float in the air for hours, and even perhaps collected at a distance beyond the 6 feet that we often hear about? Do you have any information on that, and is that cause for concern, or is there other research or other information out there that would put folks more at ease?
So, the research on coronavirus and how it's transmitted is, of course, rapidly evolving. And we originally were convinced that the infection was primarily droplet spread. And there has been some evolving evidence to suggest that it can be aerosolized. With aerosolized, you need a little bit more than a surgical mask to protect you if you are in close contact with an individual. And this also is where considerations come into ventilation systems and how environments can be controlled, how the importance of airflow is important. I think, when we look at how we have seen cases spread across the county, I would still primarily be thinking about controlling against a droplet precaution. So that's where the importance of masks and social distancing come in. Aerosols cannot just, they don't sit in the air and kind of wait for people to walk into them. It's generally in a place where there is stagnant air, and a smaller space as well. So, I think that does lend itself to consideration around social distancing, around how close people would sit within the confines of a class, about how you look at what the airflow is like in a particular learning environment. Um, so those considerations are real and they're there, and we need to use those to inform, kind of environmental controls. But I think that when we look at what the major tenets of basic infection control, you still are protecting yourself best if you are performing frequent hand hygiene, if you are social distancing, and if you are wearing masks.
Thank you. That's comforting because those are the tenets that we've been talking about for quite some time now. You mentioned masks, Commissioner Whalen, and some of the questions came in. Are there particular types of masks or face coverings or materials of which they're made that are recommended over others?
Sure, and the CDC has a great resource on this if people want to go to that website, and I would promote it wholeheartedly anyways, because that's where you're going to get your best evidence-based information. So in terms CDC website and the New York State Department of Health website, and our website, which has many links to both of those websites. So in terms of what is recommended, you can wear a medical grade face mask, like something like this, which I wear every day, which has the loops that go behind the ears. And these are readily available at places like CVS. Or you can wear a cotton face covering, which are also widely available. The importance about a mask is how you wear the mask. And, unfortunately, what we see so much is that people don't cover their nose, or they wear their mask under their chin. So it really is more about how you cover your face, and how you take the mask on, and not taking it off and on so many times. I did read something recently about the kind of gator masks that people are pulling up. I think the concern around those is that, anytime you're wearing something that you flip open, up and closed, and up and down so much, you're risking contamination. The masks can easily become wet, and when they become wet, they are not as effective. So it's not just about the mask you wear; it's about how you wear it.
Great, thank you very much. That was very informative. We've got time for one more question, and since Mr. Lynch just put his mask back on, I'm going to direct it to him. So it's been noted that the county executive's daily briefings have been very useful and informative to folks in our region. Will he be continuing those as we progress through the reopenings of both colleges and universities and K-12 schools? And will our educational institutions be part of those regular updates?
Yes. The short answer is yes. The plan is to continue the briefings as long as they're providing new educational and informative pieces for the community. There's not an end date in sight. If you followed the briefings or have followed the briefings from a distance, you've seen that the county executive has brought in a number of different guests that talk about important issues that are being discussed on the state level and sometimes even the national level. As recently as this past Tuesday, there was a gym owner who came in and discussed the new guidelines for opening gyms in a safe manner. They came out on Monday. We had the gym owner discuss those guidelines on Tuesday. The county executive has had, alongside with Commissioner Whalen, superintendents of our high schools and our school districts here in the county, where there's information to be shared. The goal of the county executive's office and of Commissioner Whalen's office is to be as transparent and educational as we can. So they will continue through the process. When there's new information to put out and guests who have a direct impact with the implementation of those new guidelines. Should there be new guidelines, they will be a part of that briefing. So short answer is yes, with a little added discussion.
Great, thanks so much. And thank you, Mr. Lynch and Dr. Whalen, for being with us today. We truly do appreciate it. At this point, I'd like to turn it back to President Rodriguez for his closing remarks.
Thank you, Bruce. And again, thank you to our Deputy County Executive, Dan. Thank you so much for being here. And Commissioner Whalen, we sincerely appreciate that both of you are here. And we really appreciate and love calling you Albany graduates. So thank you for everything that you do. And as I said before, at Albany, we highly value our great relationship with the city, the county, and with the County Department of Health. I truly think that what we have shown today is that we all need to work together to continue to fight the COVID-19 pandemic, and that's exactly what we will continue to do. So again, thank you both for being part of today's conversation. And I, of course, want to also thank, my good friend, our Albany County Executive, Dan McCoy. Please give him my regards and thank him for his strong and ongoing support as we seek to keep our Albany community up to date on the latest developments as it relates to COVID-19, but not only on our campus, but also in our surrounding communities. I also want to thank our colleagues in this wonderful broadcast studio, and it truly is a wonderful broadcast studio, which is run by our professional development program staff with Rockefeller College. Thank you for hosting and broadcasting us live. Job well done. So thanks to all the colleagues here for your excellent work. And to my Albany colleagues, thank you also for being here today. I'm told the latest number we've seen that about 599 people joined us today for this broadcast. So I'm wishing all of you all the best as the semester gets underway. Please know, I am excited about the semester commencing. I am also nervous. I do have concerns, but I am also optimistic regarding both the challenges and the opportunities that lie before us. However, let's always remember Albany, forward together. And as always, please stay safe, stay healthy, and stay engaged. Muchísimas gracias.